Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the gastrointestinal toxicity of Amanita phalloides, also known death cap mushrooms? Answer: focal to massive hepatic necrosis. Question: what is the gastrointestinal toxicity of ampicillin? Answer: pseudomembranous colitis. Question: what is the gastrointestinal toxicity of azathioprine? Answer: pancreatitis. Question: what is the gastrointestinal toxicity of cephalosporins? Answer: pseudomembranous colitis. Question: what is the gastrointestinal toxicity of clindamycin? Answer: pseudomembranous colitis. Question: what is the gastrointestinal toxicity of colchicine? Answer: diarrhea. Question: what is the gastrointestinal toxicity of corticosteroids? Answer: pancreatitis. Question: what is the gastrointestinal toxicity of didanosine? Answer: pancreatitis. Question: what is the gastrointestinal toxicity of diuretics? Answer: pancreatitis. Question: what is the gastrointestinal toxicity of erythromycin? Answer: acute cholestatic hepatitis, jaundice, diarrhea. Question: what is the gastrointestinal toxicity of halothane? Answer: focal to massive hepatic necrosis. Question: what is the gastrointestinal toxicity of isoniazid? Answer: hepatitis. Question: what is the gastrointestinal toxicity of metformin? Answer: diarrhea. Question: what is the gastrointestinal toxicity of orlistat? Answer: diarrhea. Question: what is the gastrointestinal toxicity of valproic acid? Answer: focal to massive hepatic necrosis, pancreatitis. Question: what is the half-life of digoxin? Answer: 40 hours. Question: what is the half-life of heparin? Answer: sure. Question: what is the half-life of oxytocin? Answer: few minutes. Question: what is the half-life of warfarin? Answer: long. Question: what is the hematological toxicity of aspirin? Answer: hemolysis in G6PD deficiency. Question: what is the hematological toxicity of benzene? Answer: aplastic anemia. Question: what is the hematological toxicity of carbamazepine? Answer: agranulocytosis, aplastic anemia. Question: what is the hematological toxicity of chloramphenicol? Answer: aplastic anemia, gray baby syndrome. Question: what is the hematological toxicity of cimetidine? Answer: thrombocytopenia. Question: what is the hematological toxicity of clozapine? Answer: agranulocytosis. Question: what is the hematological toxicity of colchicine? Answer: agranulocytosis. Question: what is the hematological toxicity of dapsone? Answer: agranulocytosis, hemolysis in G6PD deficiency. Question: what is the hematological toxicity of heparin? Answer: thrombocytopenia. Question: what is the hematological toxicity of ibuprofen? Answer: hemolysis in G6PD deficiency. Question: what is the hematological toxicity of isoniazid? Answer: hemolysis in G6PD deficiency. Question: what is the hematological toxicity of methimazole? Answer: agranulocytosis, aplastic anemia. Question: what is the hematological toxicity of methotrexate? Answer: megaloblastic anemia. Question: what is the hematological toxicity of methyldopa? Answer: direct Coombs positive hemolytic anemia. Question: what is the hematological toxicity of nitrofurantoin? Answer: hemolysis in G6PD deficiency. Question: what is the hematological toxicity of NSAIDs? Answer: aplastic anemia. Question: what is the hematological toxicity of oral contraceptives? Answer: thrombotic complications. Question: what is the hematological toxicity of penicillin? Answer: direct Coombs positive hemolytic anemia. Question: what is the hematological toxicity of phenytoin? Answer: megaloblastic anemia. Question: what is the hematological toxicity of primaquine? Answer: G6PD deficiency. Question: what is the hematological toxicity of propylthiouracil? Answer: agranulocytosis, aplastic anemia. Question: what is the hematological toxicity of sulfa drugs? Answer: megaloblastic anemia. Question: what is the hematological toxicity of sulfonamides? Answer: hemolysis in G6PD deficiency. Question: what is the initial management of type 2 diabetes mellitus? Answer, diet and exercise. Question, what is the intracellular mechanism of action of nitrates and nitrites in the TX of angina? Answer, conversion to nitric oxide. Nitric oxide activates cytosolic guanyl cyclase. Question, what is the main adverse effect of sulfonylureas and meglitinides? Answer, hypoglycemia. Question, what is the main clinical use of Amandine? Answer, TX of influenza only. Question, what is the main mechanism of quinidine action as an antiarrhythmic? Answer, blockade of activated sodium channels. Question, what is the main mechanism of action for all typical antipsychotics? Answer, antagonism at D2 receptors. Question, what is the main mechanism of action of adenosine as an antiarrhythmic? Answer, increases the outwards potassium current, hyperpolarizing the cell. Question, what is the main mechanism of action of beta-2 agonists in the treatment of chronic obstructive pulmonary disease? Answer, B2 presynaptic receptor agonism, thereby inhibiting ACH release. Question, what is the main mechanism of action of beta blockers in the TX of angina? Answer, reduction of cardiac oxygen demand by reduction in HR, contractility and BP. Question, what is the main mechanism of action of digoxin? Answer, blockade of the sodium-potassium ATPase by competing with potassium. Question, what is the main mechanism of action of flecainide? Answer, blocks activated sodium channels. Question, what is the main mechanism of action of procainamide as an antiarrhythmic? Answer, blockade of activated sodium channels. Question, what is the major adverse effect of ganciclovir? Answer, dose-limiting hematotoxicity. Question, what is the major adverse effect of thrombolytics? Answer, bleeding. Question, what is the major mechanism of action used by beta blockers at the kidneys to treat hypertension? Answer, inhibition of renin release via B1 blocking. Question, what is the major toxicity associated with doxorubicin? Answer, cardiotoxicity, dilated cardiomyopathy. Question, what is the major toxicity of daunorubicin? Answer, cardiotoxicity, dilated cardiomyopathy. Question, what is the major toxicity of methotrexate? Answer, myelosuppression. Question, what is the mechanism for macrolide resistance? Answer, methylation of the 50S ribosomal subunit. Question, what is the mechanism of action of heparin? Answer, activation of antithrombin 3. Question, what is the mechanism of action of warfarin? Answer, inhibition of vitamin K epoxide reductase. Question, what is the mechanism of chloramphenicol resistance? Answer, plasmid-encoded acetyltransferases that inactivate the drug. Question, what is the mechanism of resistance for macrolide antibiotics? Answer, methylation of the 23-esrina binding site, thereby preventing binding of the drug. Question, what is the mechanism of resistance for tetracycline antibiotics? Answer, an increase in efflux or decrease in uptake of the drug by bacterial pumps. Question, what is the mechanism of resistance of aminoglycosides? Answer, bacterial transferase enzymes, they inactivate the drug by acetylation, phosphorylation or adenylation. Question, what is the mechanism of resistance to acyclovir, famciclovir, valacyclovir? Answer, mutated thymidine kinase. Question, what is the mechanism of resistance to chloroquine and Plasmodium falciparum? Answer, membrane pump that decreases intracellular concentration of the drug. Question, what is the mechanism of resistance to ribavirin? Answer, failure of cells to phosphorylate the drug. Question, what is the mechanism of resistance towards fluoroquinolone antibiotics? Answer, mutation in DNA gyrase, plasmid-mediated resistance, development of efflux pumps. Question, what is the mechanism of sulfonamide resistance? Answer, altered dihydrooctoroite synthase, decreased uptake, increased PABA synthesis. Question, what is the mechanism of action of 5-fluorouracil? Answer, inhibition of thymidylate synthase. Question, what is the mechanism of action of 6-mercaptopurine? Answer, inhibition of de novo purine synthesis. Question, what is the mechanism of action of 6-thioguanine? Answer, inhibition of de novo purine synthesis. Question, what is the mechanism of action of abciximab? Answer, binding to GP2B3A on activated platelets, thereby preventing platelet aggregation. Question, what is the mechanism of action of ACE inhibitors? Answer, inhibition of angiotensin converting enzyme, ACE, thereby inhibiting RAAS. Question, what is the mechanism of action of acebutolol? Answer, selective beta-1 antagonism. Question: What is the mechanism of action of acetaminophen? Answer: reversible inhibition of cyclooxygenase, mostly in the central nervous system. Question: What is the mechanism of action of acetazolamide? Answer: inhibition of carbonic anhydrase. Question: What is the mechanism of action of acyclovir, femcyclovir, valacyclovir? Answer: guanosine analog, inhibition of viral DNA polymerase, thereby causing chain termination. Question: What is the mechanism of action of acyclovir? Answer: inhibition of DNA polymerase, causing DNA chain termination. Question: What is the mechanism of action of adalimumab? Answer: blocks the interaction of TNF-A with the TNF-A receptor. Question: What is the mechanism of action of adalimumab? Answer: monoclonal AB, binds to and inhibits TNF-alpha. Question: What is the mechanism of action of adefovir? Answer: competitive inhibition of HBV reverse transcriptase, thereby causing chain termination of viral DNA. Question: What is the mechanism of action of adenosine as an antiarrhythmic? Answer: drives potassium out of cells, thereby causing hyperpolarization and decreasing calcium conductance. Question: What is the mechanism of action of albuterol? Answer: B2 agonism, thereby causing bronchial smooth muscle relaxation. Question: What is the mechanism of action of aldesleukin? Answer: promotes differentiation of lymphoid cells into cytotoxic cells, activation of natural killer cells. Question: What is the mechanism of action of elfacept in the treatment of psoriasis? Answer: binding to CD2 on cell surface. Question: What is the mechanism of action of aliskiren? Answer: direct inhibition of renin. Question: What is the mechanism of action of all cephalosporins? Answer: inhibition of transpeptidase, thereby inhibiting the cross-linking of peptidoglycan. Question: What is the mechanism of action of allopurinol? Answer: inhibition of xanthine oxidase, thereby decreasing the conversion of xanthine to uric acid. Question: What is the mechanism of action of alpha-methyl-dopa? Answer: converted into methylnorepinephrine, which acts at central alpha-2 receptors, thereby decreasing adrenergic tone. Question: What is the mechanism of action of alteplase? Answer: activation conversion of plasminogen to plasmin, which then cleaves thrombin and fibrin clots. Question: What is the mechanism of action of amandine in influenza TX? Answer: inhibits the influenza M2 channel protein, thereby blocking viral uncoating and penetration.
Thank you for listening Dr. Izzy's Medical Podcast Series. If you want to support this project, please subscribe the channel and like this video. Thank you.